Let us learn about the EURD list, or the list pertaining to the European Union reference dates. The European Medicines Agency publishes the list of European Union reference dates and frequency of submission of periodic safety update reports, known as the EURD list. How do we define EURD list? The EURD list is a comprehensive list of active substances, and combinations of active substances contained in medicinal products, subject to different marketing authorization, together with the corresponding EU reference dates, frequencies for submission of PSURs, and related data lock points. The EU reference date corresponds to the date of the first marketing authorization of a medicine containing that active substance, or that combination of active substances in the EU. Or alternatively, it is the earliest of the known dates of the marketing authorization, for a medicine containing that active substance, or that combination of active substances. The PSUR frequency and related data lock points for a given active substance or combination of active substances in the EURD list takes effect 6 months after the publication date, and any conditions related to the frequency of submission of PSUR included in the marketing authorization. Marketing authorization holders are required to submit PSURs to national competent authorities or the agency according to the dates published in the EURD list. Besides, please note that many non-EU authorities also require PSUR submissions as per the EURD list. This is how the EURD list looks like. There are various sections in this list. We will share a link to this list in the video description. The EMA periodically updates the EURD list, and every MAH needs to keep a track of this. You can appreciate that the list was first published in October 2012, and there have been numerous revisions to the same. Are you supposed to submit PSUR always, if your molecule is listed on the EURD list? The answer is no. This depends on the article of registration, as per Directive 2001/83/EC as amended. A PSUR may or may not be required, if your product is referred to in Articles 10(1), 10a, 16a. You can find a dedicated row for this, in the EURD list. It is specified, if a PSUR needs to be submitted or not. Marketing authorization holders and other stakeholders can request amendments to the EURD list for the following reasons: first is public health, second is to avoid a duplication of the assessment, third reason is to achieve international harmonization. To request an amendment, stakeholders must complete the template and send the requests to this email address. Any changes to the list, following a request for amendment, need to be approved by the Committee for Medicinal Products for Human Use, or the CHMP, or the Coordination Group for Mutual Recognition and Decentralized Procedures for Human Products, or the CMDH. All this happens, in consultation with the PRAC, or the Pharmacovigilance Risk Assessment Committee. Changes take effect 6 months after the publication date of the amended list for the products containing the concerned active substance or combination of active substances. What did we learn today? We learned the meaning of the EURD list, and what are the components of this list. We next learned how the EURD list benefits the regulators and the marketing authorization holders. The EURD list aims to support and optimize the management of PSUR submission and PSUR single assessment within the European Economic Area. Lastly, we learnt about the amendments in the EURD list, and which agencies are involved in these approvals. We trust you found this useful. Feel free to contact us, in case there are any questions, comments, or even suggestions. Also, we request you to subscribe to our channels.